Alrighty, hello everyone. Thank you so much for taking the time to hop on to our virtual health and wellness forums tonight. My name is Maddie Hasbrook. I'm the Associate Director of Health Programming for Special Olympics New York. These forums are a space for individuals with ID, families, caregivers, and coaches to engage with health-focused individuals and organizations. The goal of these forums is to cover a wide variety of topics and in turn positively impact the health of people with ID. We do ask that you make sure you are muted and you stay muted throughout the whole presentation, but there will be time at the end to submit questions either in the chat or come off of mute if you are comfortable. So without further ado, I'd like to kick off tonight's virtual forum focused on taking charge of my health and wellness by introducing our two speakers. So our first speaker is Karleen Haines. So Karleen is a nonprofit executive with 24 years of experience in the field of human services. Prior to joining Partners Health Plan in December 2014, she was a director of vocational and employment services at a large nonprofit serving individuals with ID, supporting over 500 adults through programs such as day habilitation, supported employment, and pre-vocational. She was instrumental in developing and growing affirmative business models that support gainful work for adults with disabilities. Karleen has participated on education and workforce development committees for various disability advocacy groups and has served as a diversity and inclusion facilitator and worked as an adjunct faculty at Nassau Community College, teaching an IDD studies course. Ms. Haines oversees various initiatives as part of the leadership team for Partners Health Plan and Care Design New York. She champions advocacy efforts for the IDD community alongside members and families, seeking to raise a collective voice for a better future. Karleen also serves as the organization's DEIB officer, leading diversity, equity, inclusion, and belonging strategies for staff and stakeholders. Recently, she held roles that include Chief of Care Coordination and Chief of Community Relations and Outreach. Karleen serves on the state's Developmental Disabilities Advocacy Council Subcommittee on Housing. She is a licensed health agent in the state of New York, earned a DEI in the Workplace Certificate from the University of South Florida, and holds an undergraduate degree in psych as well as a master's in management from the State University of New York at Stony Brook. Our second presenter tonight is Carrie Delong. Carrie is a registered nurse and serves as the Director of Healthcare Management for Care Design New York and Partners Health Plan, organizations that support individuals and families in the intellectual and developmental disabilities field. She has worked in various IDD settings in her career, including day programs, clinics, residential programs, and staff training. The focus of her work has been ensuring that people with IDD receive equal access to healthcare and empowered to self-advocate. Through her passion for assisting persons with IDD and their circle of support to understand their health conditions and how to manage them, she has helped people in achieving their personal goals, including optimal independence and career advancement. She is an active participant in the New York State Intellectual Disabilities and Developmental Disabilities Nurses Association, and has recently assumed the role of co-chair for Zone 4. So Carrie and Karleen, thank you both for being here tonight. I will stop sharing my screen so that you can share yours, and I will turn it over to you.
So as Maddie said, and thank you for that long introduction, Carrie. I think we need to shorten those. We do a lot of stuff, right? So it's great to see everybody today. I am very happy to be here and to work with Carrie on this topic. For some of you who know the New York Alliance, Carrie and I actually did this presentation at the New York Alliance Fall Conference, and we brought one of our self-advocates with us to that conference. So great collaboration in building this presentation with a person who has a disability and has concerns about ensuring that they're healthy. And we're going to talk a lot about that today. So that's Carrie and myself, but you can see us on screen. So Carrie, I'm going to take the first few slides, and then I'm going to, Carrie and I are going to work together to get this information out to you all. If you have any concerns or questions, or you need us to slow down in any way, please let us know. And if you can't see or read anything and you need us to read out what's on the slide specifically, we can do that as well. So the reason why we're here tonight is to talk about a whole person view of your health, meaning all of us, whether we have a disability or not, whatever we have going on physically, that we should take a holistic approach to our own healthcare. And so what does holistic mean? It means our whole person. So how do we feel? What's going on around us? How are we feeling in our hearts and in our mind? So physically, mentally, emotionally, spiritually. And once we know how to care for ourselves, we can make better decisions. When we are feeling good, we know what to expect. That way, when we don't feel good, we know, who to ask for support, and when we're feeling unwell, we can reach out to others around us. So again, on this slide, we're highlighting you, and I can see some names here: Mindy, Naomi, Diane. Make sure that you understand your physical health, your emotional health, your mental health, and your spiritual health. And of course, this is different for everyone. And the other thing that's important is this can change over time, right, Carrie? That we don't stay static with how we're feeling. We can feel different from one day, from the different days of the week, to different months, to different ages. As we age, we start to feel a little different, and we have what we call a new baseline. So we'll talk a little bit more about that. But it is important to look after your health now, and also, what is your plan for your health for the future? So all of those, again, very important. So how do we take control of our health? And so you need to take control of your health, or you can take control of your health. And this is up to you. And we all do this in different ways. Remember that you are unique. You are special. Each of us are special. And we may need to learn and manage our health in different ways. And that looks different for all of us. So we may be able to make our own decisions and speak to our doctors and do all of that on our own. Or we may need to gain support from other people, or lean on a friend, a family member, one of our staff members, someone who supports us. And so the message here is be involved in whatever way that you can. So what you again we're saying you are special, and you are unique. And so whatever that means for you, be involved in whatever way that you can. And know where can you get support. So who can support you? I can't see all the faces, but if you could see me, and I'm waving my hand, if you can, raise a hand if you get support from when you go to doctor's visits, for example, if you have a question about something, if you get help from your family. Anybody? I see Mindy. I see you raising your hand there, Mindy. How about from staff in your life? Yeah, I see you. I got you, Naomi. And for others, it might be where you're independently going to the doctor or asking the doctor questions directly, right? So everyone can be involved in whatever way that you can, know where you can get support, and you should feel confident in being independent whenever possible in that way. So, Carrie, I'm going to turn to you so that you can talk about the annual wellness exam. And before Carrie goes through this, remember what we just talked about, which is you need to think about taking care of yourself. And one of the best ways to do that is your annual wellness exam. Carrie?
Yeah. So your annual wellness exam is a once-a-year exam that you get with your primary care doctor or nurse practitioner or physician's assistant. And the reason that it's important is because it helps your doctor's office know what your everyday is like and know you for a course of time. So if something's changing, they'll be able to notice it. You should go to them even if you feel fine. There are opportunities for you to talk to your doctor about questions that you have and concerns. They might help identify problems early. That's why you get all of the testing that you get done, such as for women, a mammogram or a colonoscopy after the age of, I think, 45. So remember that you're not in this alone, and it's a lot to go to the doctor. I'll tell you that for me, I go to the doctor and I don't remember what they say when I walk out sometimes because they've said so many things and I've asked so many questions. One of the things you can do is write things down on paper. Bring somebody with you that can help and write things down for you. If you're going alone and somebody can't accompany you, but you still want someone to hear and help you with that, ask the doctor if you can have somebody on speakerphone while you're in the office to listen in and be able to write things down from another location. Always, always, always ask questions if you don't understand something. So lean on your family, lean on your caregivers, lean on your friends, lean on your neighbors. Whoever is important and supports you in your life can help you with this annual wellness exam.
Okay. So carrying on to what Carrie just talked about regarding our annual exam, remember you can take these steps, and Carrie had just mentioned these. For example, consider if you would like to bring someone with you to the appointment, right? Such as a family member or a trusted staff member, or as Carrie said, have someone on the phone, and plan to bring with you to your visit. What medications do you take? What vitamins do you take? Do you have any allergies? Do you take any what they call over-the-counter medications, like Tums or cough drops, or those types of things that you just might buy when you go to the pharmacy or to Walmart, for example? Have questions for your doctor and think of what you want to say ahead of time. Like Carrie said, sometimes when you're there, you ask questions, but the visit goes so fast, and then you leave and you don't remember what's been said. So it's okay for you to take a pen and paper with you, or have the doctor say, "Can you write that down for me?" You can ask the person who's accompanying you or who's with you there at the appointment to write things down for you, right? And ahead of time, plan for things like how long your visit might be. Do you have to get there early because of where you need to park or take the bus? When you go, do you want to get a vaccine or something special? Let's say it's fall and you want to get your flu shot, those types of things, right? So planning ahead.
I think the other thing is that when you choose someone to accompany you on an appointment, that's an important thing, that you want someone that's trusted and you're comfortable with. And I think, when you can advocate for that on your own behalf to say, I would rather have a male staff person come with me if I'm male, or a male friend, or I'm going for, a test, and I would rather have a female be with me if I'm a female. Those are things that you can really advocate for on your own, for that support person. You're muted. Oops, sorry.
Yeah, that's a great point. Is what is your comfort level? What do you feel comfortable with? And speak up for yourself if you think you need to. Okay, so let's talk quickly about a life plan. Some of you who are in specific services who may have a care manager or other staffing supports in your life, or you're in school, you might have a plan of some kind. And in this case example, we're going to use the life plan, which basically any plan that spells out what your goals are, right? So set some goals for yourself. And don't forget about your health and well-being. So in your goals, you should talk about your health. So I'll share something with you that I do in the beginning of the year. I always look at what my weight is after the holidays. And I tend to say, you know what, I'm going to lose a couple of pounds this year. 5, 10, any pound, any amount of pounds that the doctor says I should, and to keep myself healthy. So that's an example of a goal that you can set for your own health. So when you do that, it can help you plan, it can help you stay on track. And when you write it down, it helps you to remember, and it helps you to get the support that you need around that. So, for example, if you live with other people in the home and you're trying to lose weight and there's a lot of cookies or chocolate in the house, it may be difficult to say, well, I'm not going to have that cookie. And letting the people around you who support you know what your goals are so that you can lean on them and they can lean on you. So examples could be to get more exercise, right? And that might be that we're joining a gym, that we're going out for a walk in the park. We could take the stairs instead of taking an elevator. It's important to start small. Some of you might have a pet at home, a dog that you might walk around the block. So you don't have to say, well, I'm gonna walk 2 miles a day. Even if you walk a half a mile and you walk a half a mile from home and then you walk a half a mile back, you're getting a mile in, right? So think about starting small, and over time you can see changes. Now, some of you on this call are athletes, right? Because we're connected to Special Olympics. So the athletes, I'm sure, are going maybe a mile or more, probably more than me, on a walk every day. But that's very important is to remember it's okay. You don't have to feel overwhelmed, and you can start small. You want to, if you can, become more independent. So some of us may be able to make our own appointments, meaning we may be able to pick up the phone and make a call and say, okay, I think I need my dental cleaning. I'm going to call the dentist office to make that because I'm open on Thursday afternoons. And I am going to check to see if they have an appointment on a Thursday afternoon. So you can do that on your own. You can learn about your medications and understand your healthcare diagnosis. So let's just stay there for a quick minute. And Carrie, obviously, we talked about Carrie being a nurse. Carrie, when we say learning about our medications and our healthcare diagnosis, we're going to talk in another slide about medication specifically, but what does that mean when we say know about your healthcare diagnosis?
Well, I think it's important to know a lot of things about your healthcare diagnosis. Let's take something like diabetes. I don't think you need to know necessarily how diabetes works in your body, but you need to know what the signs of what would show you that you're taking care of it well, and what would show you that there's a problem. So if you have, say, arthritis, we'll say, and you take some medication to help with your arthritis, and you notice that your joints are achy, by learning about your diagnosis, you know when you need to let somebody know that something's not working right. The same thing about your medications, knowing what the side effects might be. As a nurse, I might know 70, but if you know that I take this medication, it might make me sleepy, and all of a sudden I realize I've been kind of extra sleepy, then I know I need to let somebody know. So knowing about your medications and your diagnoses, will really help you advocate for your healthcare, because you're going to know what's normal, what's not normal, and what's really not normal, and when you should go to an emergency room as opposed to waiting to call your doctor.
That's a good point. That's a good point. Yes. So that is exactly, what we need to know, Carrie, and I thank you for sharing that.
Yeah.
On the subject of a healthy diet and losing weight, we talked a little bit about that. You might have a part of your plan is to understand what meals you will eat that day or that week. And if you're planning for the week, Are you going shopping, or are you creating a shopping list with whoever is going shopping? And so again, what you're eating, what you're drinking, how often, how you're shopping, what food you have in the house, all of those again can support you in having a healthy diet. Getting others involved to try and make it fun, or set challenges with your friends or your fellow athletes, or your teammates is very important. And like we said before, share with others, so you're not the only one who knows what your plan is and what your goal is, that you can have others support you.
I think the other thing, Karleen, is you don't have to change it all at once. It's those small steps that we talked about when we talked about exercise and being active that lead up to big changes. So don't worry about, I need to change the way that I eat today, and I need to eat completely different tomorrow. That's not really what making change is about. Making change is slowly integrating or installing better decisions that add up over time. And all of a sudden you realize, wow, I used to eat a healthy breakfast, and now I eat a healthy lunch, and now I'm also eating a healthy dinner, or I'm not snacking as much in the evening. Those are all wins that you can celebrate and mean that you're making steps towards your health.
Mm-hmm. We also, we've talked, Carrie, when we've talked to folks about other ways to chart. Some people use Weight Watchers, some people use a marker board on the refrigerator, others use an actual notebook with a pen. Some folks have a smart watch, right? That's checking how many steps they do in a day. Your cell phone sometimes can, if you have it in your pocket, can track how many steps you have a day. And there's a lot of apps, for example, for your phone and your tablets and things that you can use. So think about that as well. So this slide, your healthcare, your choice. Remember, it's your healthcare, so it's your choice, and that you should have a voice. You have a choice in which doctors you want to see, and that could include your primary care physician. So on the slide, you might see the letters PCP. We mean primary care physician. So that's your doctor, the main doctor that you've seen, and that you see every year. Or when you're just sick, you might have a cold, or you may go for your flu shot. That's your regular doctor, if you will. And then sometimes you have a specialist, and the specialist could be a podiatrist, a gynecologist, a cardiologist, those types of folks. And so, you see dentists, for example, you see those folks as well for your healthcare, and it's your choice who you see. Now, second opinions, if you felt like you have a new diagnosis, or there's a new treatment that you have. Carrie mentioned before diabetes. So if you get a new diagnosis and the doctor says, okay, Carrie, you have diabetes, and there's going to be a new treatment for you, and a new worlds that you have to follow, it's okay to feel comfortable with asking questions. I don't understand this. What does this mean? What can I expect? What will I feel? Are you available for me if I want to ask questions? Those types of things. All right, so very important there. Anything to add, Carrie?
Yeah, I think that to really understand that if you're not comfortable with your doctor or your provider, whatever they are, speak up. And, I go back I'm a woman, so I go back to women. If you want a woman doctor, or you're a man and you want a man doctor because you're more comfortable with that, advocate for that, talk about it, because I want you to be as comfortable as possible going to an appointment so that you're able to share whatever you want to share with that provider. I've gone to doctors and been like, this is not the doctor for me, and just found somebody else. It can be challenging to, make that change a little bit, but it is your right as a consumer of healthcare services, as a customer and a patient. It is your right to, just like when you go to the grocery store and pick the brand of facial tissues that you want, to pick the doctor and the medical provider that you want.
And very important, Carrie, right? Even more than the tissues, right? So
Yeah.
Sometimes we take more care about what shirt we want to buy in the mall than we do about picking our doctor. So it's
Sure.
very important. Okay. So Carrie, this slide, we talk about healthcare and baseline health.
Yep.
Can you talk to us about what is baseline health? And again, this is building on the things that we've talked about in the previous slides, but this is very important for how we feel and when we may seek support and help, right?
Yeah.
So tell us about baseline health.
So your baseline health is, first of all, it's different for everybody. I know that it can feel, everybody feels a little bit different. So I know that it can be a little challenging to understand that you might, if you use a wheelchair for mobility and you have contractures or spasticity in your limbs, you might be in pain every day, but that might be your baseline. You might have a low level of pain, or if you have arthritis, your knees might hurt, or if you have a hearing impairment, you might not hear as well, or you have to wear glasses, or those kinds of things. Those are all your baseline. It's different for everybody, and it changes over your life. I don't know if anybody here is aging like I am, but I stand up from sitting down after a while and go, wow, I am not 20 anymore. And that's okay. This is my new baseline, that when I stand up, my knees crack a little bit.
So Carrie,
yeah,
it's safe to say that's how we feel on a basic, average, normal day.
absolutely. Yep, it's just how you usually feel when you wake up. Why it's important to know that is because you need to know what you feel like on a normal day to know when you don't feel right. There are two different types of illnesses. There are short-term and acute. Those are things like you get the flu, or you get a cold, or I'm trying to think of another example. But then there's also long-term and chronic. And those are illnesses that last a long time. So there are things like high blood pressure is a good example, or
so you could say short term, maybe I sprained my ankle, or
yeah,
right. So
or I have a
that's
toothache.
would heal a toothache, right? Those are the short term, and the long term, like you said, diabetes, arthritis,
High
right?
blood pressure.
Right. And so we could take medications in both cases, right?
Absolutely.
Yeah, yeah. And some of those in either a short term or long term, you may need to see the doctor for either.
Absolutely. So medications are important. First of all, it's important to know, I don't even always know all the names of my medications that I take. I get put on an antibiotic. I'm going to take an antibiotic. I don't know which one it was. I go to somebody says, which one are you taking? And I go, I don't know the antibiotic my doctor put me on. It's not necessarily important to know the names, but to know what you're taking a medication for and what you should expect from it. So if I take a blood pressure pill, I might not feel any different. When I go to the doctor, my blood pressure shouldn't be high anymore. If I take a medication for arthritis, my joints should feel better. If they're not, that's when you want to speak to somebody and let them know this isn't working for me. It doesn't mean that medication won't work. It might mean that you need a different dose or a different medication. But it's also important to know what the adverse effects or the things that the effects that are not to be expected. That's things like if you take a cholesterol medication like atorvastatin or Lipitor or simvastatin, those medications work to bring your cholesterol down, but they can also cause your muscles to ache. And if you don't know that that medication causes your muscles to ache, but you feel really achy every day, you might think that's a new baseline, but really it's you started a new medication and this is an adverse reaction to it that if I let my doctor know or my nurse know or my staff know or my mom or my brother or whoever I'm close to, they could help advocate for me to have a different medication or a different dose. So those are some good examples of why it's important to know what you take.
And
Not
we
necessarily.
would we call those side effects. That's another way to say that,
Yeah.
right? So
Yeah.
you might hear the term side effects, and that's the same as Carrie saying, I take this medication and the doctor put me on it because they want me to feel better because of this thing. But now I'm feeling worse because of the medication. And you need to speak up, or you should feel comfortable speaking.
Yeah. Things you might feel: upset stomachs, dizzy, sleepy, your mouth might be dry, you might feel achy. Those are all things that if you don't feel those and you start a new medication, you definitely want to let somebody know so that you can get that changed, because taking a medication doesn't necessarily mean that you have to live with something else. You shouldn't be adding another problem on top of taking care of the original problem that then you need to take care of the other problem for. So let your doctors know those things.
So accident or injury, this one, like we said, sometimes can be short term, right? Like we said, you tripped, or you had a fall and you have a sprained ankle, or maybe you slipped in a bathtub or something. However, sometimes those accidents or injuries can be long lasting, right, Carrie?
Absolutely.
And then you have a new change, a new challenge, right? And you might need to have a walker for short term for your ankle, but some folks have a life changing event that occurs that they may need that for more than just a couple of weeks or a couple of months, right? So sometimes it's life changing.
Well, that can be hard, not just physically, but also like mentally. And I think it's important that you not only take care of your body, but you also take care of your mind and understand and do the things that you need to do to work through those things. Because if you have a big change, let's say, I mean, God forbid you had, a stroke and now you needed a wheelchair when you could walk. That's a lot to go through. It's not just the physical part, it's also emotional and mental.
Absolutely. And that's where the support around you comes in. So
Yeah.
when it comes to medication, whether you're taking it for a short term, like a flu or a cold, versus high blood pressure, right, which is long term, talk to us about this slide and what we need to know about adherence. And before you answer that, Carrie, or talk more about that, in this slide, when we say medication adherence, that just means, are you taking your medication? Are you sticking to the plan? The doctor has a plan for you, and the doctor said, well, you take this medication at 8 in the morning and 8 at night. And so if you miss one of the 8 at nights, that would be, whoops, well, we didn't stick to our medication adherence, and that we might have a negative effect from that. So that's what we mean when we say adherence, basically sticking to the plan.
Yeah. So most medications don't work unless you take them the way that the doctor wants you to take them. So if it's supposed to be taken once a day, you should take it once a day. If it's supposed to be taken twice a day, you can't take 2 of them in the morning and say, I took 2 pills. You need to take that twice a day. Medicines work differently and they need to be given at different time frames. Taking it the right way, if you take something like Synthroid for your thyroid, that should be taken in the morning on an empty stomach. Or if you take a medicine for heartburn, like a omeprazole, you want to take that on an empty stomach in the morning as well. So that's taking it the right way. Should you take it with water? Should you take it with a full glass of water, or can you just take it with a sip? If you take meds like Miralax, how much water do I mix the Miralax with to get the right concentration? You want to make sure you take the right medicine. I don't know about anybody else, but in my little bottles of pills, I have a bunch of little pills, and they all kind of look the same. They're all little, either brown pills or white pills or whatever. Make sure you're taking the right bottle. And I think one of the things is, it doesn't matter how you know it's the right bottle. Maybe you put a yellow sticker on all the medications you take in the morning and a green sticker on all the medications you take at night. And that way, you're taking the right med. And if you take more than one of that medication, maybe you put 2 stickers on it. to remind you to take 2 of them. So that helps you with taking the right medications at the right time, in the right dose, and the right way. When you do that, your medications are going to work the best they can in your body. One of the things that's hard is if you go to the doctor and your blood pressure doesn't get better because they put you on a blood pressure pill, then they're going to want to increase your medicine. So then if you start taking it the right way, you might have a side effect because now your blood pressure might be too low because you hadn't been taking it right the first time. So if you haven't been taking your meds at the, on schedule, just let your doctor know. No one's going to be mad at you. They're going to be appreciative that you've let them know that, yeah, I started this medication, but I forgot to take it a few times. So maybe they would check your blood pressure again in a month and not change it right away.
That's good. Good tips and tricks, as you said, Carrie.
Yeah.
And just to add to that, I know I'm just watching the time. I know we want to be able to open up to some questions. As Maddie said in the front part of this, that just to echo what Carrie said before, you know why you need to take that medication. It's okay to ask questions if you're not sure. Why do you want me to take this medication? What is it for? And monitor how you feel while you're on the medication, especially when it's new. And if you don't understand why, ask your doctor to explain. So I know we're kind of repeating some of these, but it's very important that as part of this, you should feel confident in being as independent as possible. So again, it's your health. Ask the questions that you have. Speak up. Remember, it's your health. Your doctor is there to help you. They're there to support you. Make sure you understand the answers. Ask the person to repeat. I've done that too, Carrie, when I'm in a visit, and I'll say, "Okay, can you just say that one more time? Please say it again." And so that's important too. Some of us might speak a different language, and we may need some translation. Some of us might need things to be written down for us. And however you think that you need to get this in a situation where you feel comfortable, very important.
Carleen, one of the best things you can do is actually say, this is what I understand. So when a doctor or somebody says to you, do these things, go, okay, so you want me to do these things. And then if maybe because I do this all the time, I heard something different or heard something wrong, and they'll say they can help you correct and understand the plan when you leave the office.
Mm-hmm. Yep. That's important. In other words, I understand this. I don't understand this. Can you explain that again? Can you write it down for me? And I know some of us like to use our phones or the internet, and certainly there's times when you can get answers to questions, but that's not the best way to get health information is by using Google, right? The best way to do that is by talking to the nurse or your doctor or in your family and friends who help you to get the answers that you need from the right source. So prepare ahead, think of questions, say, well, I have my foot doctor podiatry appointment coming up. What questions might I have? You might make a list and lean on those you trust to help you make those lists. So as you're making healthcare decisions that affect your life, the choices you make today can have long-term effects on your health, and preventative care is very important. So preventative care, you may hear that term a lot. It basically means proactive, ahead of time, right, Carrie? So those are words we might use when we say preventative. We just mean, let's take care of ourselves ahead of time so that we don't wait and wait and wait, and then our issues become so built up that we become very sick, and that's not what you want. You need to think about, we talked about age, Carrie, right? Your gender or your orientation or your family history. For some of us, if our parents have heart disease, it's possible that we may also have heart disease, things like that. Other health conditions we need to think about and know those whenever we can, or bring people with us that can help us to answer those questions. right? And as Carrie said before, it's never good to think about being sick. We don't want to think about being sick, but understanding and allowing yourself to get care early will help you in your treatment if you let you need it. And you want to stay independent. For those of you who have your own apartment or have a job, being sick can risk some of those things for you, right? And you can risk your independence. You might have to go into the hospital for a couple weeks, which might harm your job, things like that. So you really want to be able to be proactive with your health. And these are some of the tests that we list here, Karen, right? Eye exams, dental exams, and teeth cleanings, mammograms, colonoscopies, having blood work, if you have your diabetes, taking your diabetes, A1C tests. These are examples, your flu shot of proactive tests. Anything to add, Carrie?
Yeah, I think that it's really important to know that getting preventative tests done help identify things earlier. And a lot of times when you identify things earlier, the treatment is easier and more successful. So it's kind of like if you're walking around and you got a button hanging off, fixing that button prevents you from having to then get a new shirt because you lost the button when it fell off. So it just helps you get the care you need when you need it.
Well said, exactly. And so this slide, we just again highlight healthcare changes that you make today help you to have a better tomorrow. So stay active. Remember, little changes can make a big difference. Keep a healthy diet, stay hydrated, drink lots of water. If you're smoking, try to quit. Limit the amount of alcohol that you drink. Take self-care, emotional and mental wellness. So for some of us, that's taking a walk. Some folks might take yoga. Some folks do breathing exercises, stretching. Again, taking care of your health now and planning for the future is a great way to stay independent and healthy for a long time to come. So we wanted to highlight this and open up for questions shortly. But in these next two slides, we talk about a sick day plan. So this is highlighted, and we can share this out with the registrants, Maddie, these are tips for a sick day plan. So again, we don't want to think about being sick, but let's plan in advance. Who's our emergency contact? Who would you reach out to? Who's your decision maker? If that's mom, what's mom's phone number? How can you get to mom during the day? Those types of things. Who can help you making those decisions? Identify early. I'm not feeling great. And you know what? I've been feeling this way for about a day now. I really think that I should reach out to someone. Having early intervention, if you're identifying something early, call your doctor, call a friend, call urgent care, maybe perhaps use telehealth, anything that you can to reach out for support. Everybody's plan is different, right? Everyone's sick day plan will look a little different. And you can make a list ahead of time. Like we're saying, who would you call? Who's your decision maker? What's the fire department's number? What's your doctor's number? What's your dentist's number, right? What's your neighbor across the street? All of those special numbers and lists that you might need. What medications are you on? Things like that. So remember, it's okay to ask for help and let people know that you don't feel okay. So don't mean to rush through this, but again, we want to plan for a sick day, very important. And on the last slide, really, we have additional resources, Carrie, right? We wanted to make sure people had some, and we can share these out as well. Some of these are clickable links that you can find forms, like the one you see on the screen, where you can print those or order them and have them come to the house, and you can use those to put up on the fridge, have them filled out by a family member or a friend. And so we think, again, it's important to have those lists and plan for your sick day. So, Maddie, if it's okay, I can stop sharing.
Yeah, sure.
Okay.
So thank you both so much. That information is really great. I think it's not only great for just the people on this call, but for everybody in our community. So we will post this as a recording too, so that everybody can get this information as well. But right now I do want to open it up for questions. So if anybody has a question, you can feel free to come off of mute, or you can send anything through the chat as well.
Hello?
Hello, we can hear you.
Oh, lately, does this make sense when I'm saying lately? My whole life is not where my life is now, okay? I've learned a lot, and my life has changed around, and I hope I can share just for a quick minute what's made going to the doctor's appointments and surgery appointments much better for me. Does that make sense? Than in the past. But I've learned some key things. Is what I can share. Is there any way you can share with other people? Because I found some critical factors that have been missing in my life that are now happening in my life. That is making a whole lot of difference.
So why don't you give us one example, Naomi?
Oh, okay. In the past, what you don't say, and that's why I'm really glad you're taking a minute. It's not enough what I have learned to bring a body to a doctor's office. Okay, I've learned that the hard way. So it's critical to think about who you choose to pick to go to the doctor's office. I found that if the person doesn't advocate and just shut their damn mouth, just walks in, shuts up, and sits down, that's no good for me or my friends. So if they can't advocate for you, that I find that's the wrong person. If they can't speak up or have questions or take notes at the doctor's office, then they're turkey to me. I don't know how to say this, but now
We gotcha. Yeah, we understand, Naomi, that I think if I can clarify what you're saying and share with others that it's important who you pick to go with you.
I got helpers. Yes. Yes. And even think about will the person the last couple of appointments I've had, like about surgeries, has been they're taking notes, right? At the doctor's appointment, they're taking notes, and then they'll even so that's good. That's helped a lot. Then the other players in my life can see what the doctor said, and they're even asking me, the person who's taking notes, who do you want to send to? So they're not assuming I want it sent to the world, which respects my wishes. So they're asking me, every single person who's taking good notes, do you want me to send it to your mother? And they're giving me a minute to think about, do I want to give it to my mother? No. Do I want to give it to a therapist? Or no. Or staff is giving me the ability to, they're asking me. They're writing the notes, they're sharing them to me. And then they say, well, who do you want to know this information? That's never happened. All this stuff has never happened to me before, but it's a good positive thing. Does that make sense?
Yeah, no, it's excellent to hear, right, Carrie? Because that's what Carrie was saying before.
Naomi,
right?
one of the things I would also say is it's important that for the person that's going to go on an appointment with you, that you talk to them beforehand about what your concerns are and what questions you want answered, so that they're prepared to advocate for you as well if you need help with communicating that advocacy. So don't feel like you can't have a conversation before and you say, well, I'm going to see a surgeon and these are the things I'm concerned about, because I might be concerned about different things than the doctor is concerned about. My concern.
No kidding.
Yeah, right.
And even take it one step further, what I thought I was concerned about surgery, then you got a mom and a sister, and they live out of state. They had concerns too. So, but then I had to think, well, do I want to bring them up? And then when they brought them up, mom's concerned about surgery for both surgeries. I asked, and that helped because then they've been doing research.
Right.
But the final thing was that the staff are asking me, do you want me to send this to your mom or not send this to your mom? And I know. Now, how respectful is that?
That's wonderful. And I think it is important to use your whole support system, your mom or a sibling or a friend, to help you with knowing what questions you want to ask and what concerns, because we all think about things differently and we all have different experiences, which might make a difference. I see Diane has her hand up. Maybe she has some advice on that too, Naomi?
I actually have a different question.
Okay.
I wrote it down before I said it. Like if if the pharmacy says that your medication is refilled and is the wrong one from a different doctor, what should I do about that?
Yeah. So the first thing is to ask the pharmacist, did you get a new prescription for this? The second thing is to call the doctor that orders it, that
Okay.
prescribed it to you. Mistakes happen all along the way. It could be somebody
Yeah,
pressed
yeah.
the
I
wrong
just wanted to
button.
know if they do that by some mistake, you know?
Absolutely. That is a wonderful thing to do. If you pick up your medication from the pharmacy and something doesn't match, when you get home and look at your old bottle or your old
Yeah,
package and your new one and
yeah,
they don't match, always stop and ask the question, why did this change, or when did this change, or who changed it,
yeah,
before you start taking it.
yeah. I just wondered.
Yeah, that's a great question. And I think that's a great thing to pay attention to.
Yeah, yeah. Because sometimes it can happen.
It
Yeah.
happens all the time to everybody.
Mhm.
Yes, it
Diane,
does.
that happened to me where I got a new pill bottle and the old pills were pink and the new pills were brown. And I
Hmm.
was confused because they look different. So I had to call the doctor and they helped me to say, it's basically the same medication. It's just
Oh,
a different brand.
oh, yeah, yeah,
So
yeah.
yeah, but I didn't want to take it, like Carrie said, until I knew that the pharmacy didn't make a mistake.
Yeah, I don't like when they do mistakes.
Yeah,
Well, it's
exactly.
hard because those medications can change shape and size from month to
Yeah,
month
yeah,
when you
that's
fill it.
true.
So
Yeah,
if you always take a small oval pink pill and
yeah,
all of a sudden
yeah,
it's blue, never take it until you check with the pharmacy to say, why did my medication change? Or your
yeah,
doctor to say, why did my medication change?
yeah,
Um, if it looks different or it tastes different or it feels different, always ask the question before you take it.
yeah.
Great question. Thanks, Diane.
No problem.
Are there any other questions?
Something in the last 2 years, maybe 1 year, that's turned my life again around healthcare needs dramatically to the benefit of me. I I was doing good getting good primary care, okay? Very good. And the doctor got to know me, I got to know her. But guess what? She stopped working, that's it. And then she had said, if you go to these two male doctors in my office, it's going to be a terrible experience for you, right? And good Lord, it was. So what I have discovered, it's worth it to investigate into a good primary doctor. Because now I have one that will talk to my staff, will talk to me, and if I don't understand some, she won't say, time's up. So I've never had this experience. So I found when you, and the other thing I found, people rely too much on just a case manager to say, do you know a primary doctor? And I have found if you start speaking to other people saying you're not happy, maybe somebody else knows another good primary doctor. Does that make sense what I'm trying to say?
Absolutely,
Just
Naomi.
rely on a case manager for their feedback, or maybe the case manager don't live in the neighborhood. Because I've had some that live far away and they don't know the area. But a therapist of mine said, well, I know a good one. Why don't you go to this one?
So Naomi, that's the term we would use when we say referral, right, Carrie? So when you hear the word referral, that's where your primary care doctor or even a friend or a neighbor is saying, I know a good doctor. I'm referring them to you. You should check them out. So you may hear the word referral, but it's important, right, Carrie, that we said the primary care physician is kind of the center of your healthcare.
Right,
And
but
so,
when it wasn't working, when I was getting horrible primary care, just and I kept saying, we got to get rid of the two turkeys I was with. But then I found one that listened to me, and it was worth looking around, and maybe it could be somebody else making the referral.
mm-hmm.
Absolutely. The important thing is that you find a provider, a primary care provider, a specialty provider, a therapist, or whatever that you're comfortable with and that communicates to you in the way that you're comfortable with and takes the time that you need. Some of that stuff you can also, let the office know beforehand. It's going to take me a little bit more time to understand what the doctor's saying, because I need to have someone write it down and then read it back to me, and whatever you need, you should ask for. And until you find the doctor or the nurse practitioner or the physician's assistant that's able to provide healthcare to you in the way that you want it, you're absolutely welcome and free to find more people, and using things like church from people that you know from church or from work or friends, or any number of people might know somebody that goes, you know what, when I see this doctor, they listen to me really, really well. And I think this is somebody that would listen to you really, really well. And you also can meet them. You can go in and just meet them and say, I don't want an appointment. I don't want an exam. I just want to meet you to see if I like you. Because I'm sure everybody's here met somebody and you're like, I just don't like them. It's just, they're whatever it is. We don't get along, and that's okay. I want someone that I feel comfortable with, especially with my healthcare. It's so important that the person that I'm talking to feels comfortable with me, or I feel comfortable with them.
What has helped this person has worked with other. The reason my therapist suggested her, because she already worked with people, a good caseload of people with disabilities. So she's not talking to a therapist, she's talking to me. So I like that.
Yeah. Well, that's actually a really good point, Naomi. Not all doctors, when they're in school, learn to take care of people who have disabilities, and they don't
really
all know. No, it's really it's something that puts people with disabilities at a little bit of a disadvantage in healthcare, because not all doctors learn the things they need to know to take care of you the right way. So when you find a doctor that takes care of a lot of people who have similar needs to yours, they're going to be better at doing that than somebody who doesn't know. And it might not be that they don't want to, but they don't know how to. So sometimes your job is going to be to teach someone the way to take care of you as well.
That's
I just wanted to share what I've learned just lately.
That's amazing.
Thank you. So I know we're a little over, Maddie. I hope that's okay. I wanted to, on behalf of Carrie and our organization, we wanted to say we're appreciative of you hanging out with us for this hour, and hopefully Maddie and the Special Olympics of New York team invites us back again, because we love to be able to meet all of you and to share this information. So I will say thank you. And Carrie, anything else to add before we go?
Yeah, thank you for spending this time with us. And remember that it is your choices and your healthcare. So stand up for what you believe in and what you want in your healthcare.
So thank you all for being here. This virtual recording will be posted on our Special Olympics New York YouTube page later this week. So please feel free to share that recording with anybody that may be interested in watching this that wasn't able to make the call tonight. And I did send a Microsoft Forms link through the chat, so we would appreciate it if you could take the time to give us some feedback and let us know future forum topics that you are interested in seeing. And that form also has a link for any additional questions that you may not have gotten to ask on this call tonight, or maybe that you weren't comfortable asking with the whole group. And I also just want to thank, Care Design is our sponsor for these health forums, so it's even more special that the both of you are here with us tonight. So thank you to Care Design, and thank you to you both for being here, and we hope that you all have a great night. Thank you, everyone.